Hi, it's Dr. Ron here, and there are certain themes that I return to time and time again, and one of those is on the importance of exercise. I address it different ways at different times, but one of the things I would like to highlight today is the importance of exercise as a form of medication for your body. It can actually be said that exercise is a miracle drug. We all know that exercise really improves the body, that it increases muscle, it reduces weight if you don't overeat while continuing to exercise. It can also be an aid to socialization because there are lots of things you can do with uh, partners, gym buddies, uh, types of exercise like uh, tennis, paddleball, pickleball, uh, running groups, various ways in which you can exercise with others. What some people don't appreciate is how much exercise does for the brain, that it delivers uh, increased blood flow and increased nutrients to the brain that really helps a person to function most effectively cognitively and to be able to do it as long as possible to ward off signs of dementia and so on. So it's really important to incorporate exercise into the normal lifestyle. Um, it's also kind of good to not do it on a haphazard basis. So I'm going to give a real kind of simple, brief prescription for exercise and types of exercise so that you maximize your body's response to it, your brain's response to it. First of all, I think that stretching is an important thing to do every day. There are lots of books and online uh, programs that go over what stretches are, but it's probably the most natural kind of thing that we can do to really improve joint health and loosen muscles and guard against injuries and so on. So that should be a daily kind of thing. When I say daily, I don't have a problem with people taking a day off on any kind of exercise once a week, but should be pretty near daily. The other thing that should be daily as people get older is to do balance exercises, things like figure eights, standing on one leg, but make sure that you're near something that you can hold on to so that you don't risk falling, because that's the whole point of balance exercise, is to guard against falling. Aerobic exercise, and the easiest one to do for most people, is walking. To be able to walk on a daily basis, I build a 45-minute walk into my daily uh, schedule, and I think that, if you can find ways of getting at least a half hour of walking in, not necessarily at one time, that can go a long way toward improving your health. And then 2 to 3 weeks, 2 to 3 times a week, if you can do some kind of muscle building resistance exercise using any combination of weights, cables, uh, resistance bands, or even using water bottles or cans, things that you have around the house that uh, help to build weight. The problem with using some of the household objects is that you can't always find ways of increasing the resistance as you get better. Uh, because with weights, you can always add weights, or you can uh, pull on resistance bands uh, harder, use a higher level band, or do more reps on it. So those are kind of the big four with respect to exercise, to make sure that on a daily basis you get in stretching, balance exercises, um, the aerobics, and 2 to 3 times a week to do some resistance weight training type of exercise. You can do that, you can go a long way toward improving the health of your body, the health of your brain, and maybe even the health of your social involvements if you work out with other people. And don't forget that there are other things you can do from an exercise sports related standpoint, but this is kind of your basic body maintenance that I recommend to everybody who is physically able to do so. Till next time, it's Dr. Ron Kaiser wishing you all the best. Looking forward to talking with you again.